Hi everybody, it's me, Monica. In case you haven't noticed me for the last 5 semesters, I am your classmate. Today we will be talking about the elbow joint. For the first view, I have an AP projection, which consists of the distal humerus and the proximal radial head and the coronoid process, but in reality that's the joint. It's more of the radius and the ulna, which are the main bones that make up the elbow joint. I will go ahead and go over the anatomy briefly so that we can go into our projections. So right here, this area, which I was not able to highlight, but it's because with the little dense area that I was talking about. Okay. So as I was saying, this little dense area has kind of like an insert there. Is known as the coronoid olecranon fossa, which is where the olecranon process goes into. On the medial side, we have an epicondyle, which sticks out here, this rounded part. On the lateral side, we also have an epicondyle on the lateral side. Then the ulna has the coronoid process, which is met by the trochlea. On the opposite side, which is the radius, has the radial head, and it meets with the capitulum. They're a match. This is the neck, highlighted by the green area, and then the radial tuberosity, which we should not confuse with the ischial tuberosity, which we sit on. Okay, or the AP view of what would be your elbow joint. Next, we're going to talk about the lateral. This is your lateral view, which also, as I stated before, it's made up of your humerus, your ulna, and your radius. The radial head now is on a lateral side, which is a 90-degree angle, so you will see the side view of all the anatomy. And this is the coronoid fossa, which was that little indentation that I showed you earlier in the gray area. The olecranon fossa, the capitulum, the trochlea, olecranon process here. This is the coronoid process by the dotted lines. And this is the anterior fat pad, which I'll also get into more detail. This is the radial head here, and the radial tuberosity, which is facing anteriorly in this view. Okay? Our next and final anatomy review will consist of the fat pads. The fat pads are important to point out due to pathology, and also because when we do trauma views, this is what the radiologist will be looking for. The most important one is the posterior fat pad. That is a clear indicator that there is some trauma or injury to the elbow joint. The sale sign one is given the name of the sale sign because of the shape of the top of it, and it's known as the anterior fat pad. And the third one is a supinator fat pad. I don't have like an actual image, but it is on the anterior side of the radial bone, radius bone. So those are the 3 fat pads. It will be on your quiz. There are 3 fat pads: anterior, posterior, and supinator. So thank you all for this part of my video. All right, guys, I'm back. This is part 2 of elbow projections. So it's going to be the AP, the lateral, no obliques, and then the Coyle method. And I hope that after this, you guys will have a better idea of how to do these projections if you're having any trouble like myself. So for the AP, we're going to have the patient sit down. I'll be doing her left elbow. So you want to try to put everything at the same level. So I have her sitting down, and my patient's name is Ariana. I call her Ari. And I have her sitting down facing me, her elbow totally on the IR plate. We're going to try to center it and put it out flat. When you're learning to do this projection, one of the tricks that I wasn't told till later, and I'll tell you guys now, is to make sure you kind of have the patient on the same plane, but also you're going to try to get the epicondyles parallel to the IR. So the trick is you have the patient, if necessary, kind of lean, if not, towards the IR if that's needed. Okay, some patients get it right away. You'll need to tell them to lean. Otherwise, just make sure that they are parallel. So we start off with the arm in an AP position, and you want to do it cross. CR is going to be, the IR plate is going to be 10 by 12 lengthwise. I'll move my tube over, and you do want like about a 40-inch SID. All right, we're good there. Okay. You're going to go ahead and center to the elbow joint, so it'd be kind of like in the middle, right about, I'll have her move over a little bit. There you go. Okay, her hand is supine. All right. And then you just want to make sure you collimate maybe about 3 inches this way from the midpoint, 3 inches the other way, and then you want to collimate side to side about 1 inch. And make sure you put your marker. Can I borrow your marker? Somebody? Anybody? Thank you. And then you want to put it as the left one. And then you just have your patients remain still and let them know you will be taking the exposure, and that is your AP view. Okay? All right. For next view, we'll do the lateral. Okay. Welcome back again. I have our next projection is going to be the lateral elbow. If you're wondering how I got here, we started with the AP view, and then we made the 90-degree flexion. Same thing, very important. You want to have the elbow joint centered. Okay. And I kind of tell my patients to put their hand kind of like in a karate chop position. Okay, same thing, make sure that the patient is at the same plane, and she is 40-degree SID. There is no angle for this projection, and if necessary, you will go ahead and collimate. Over, over. Okay. All right. She's pretty much there. I will go ahead and take the exposure, have the patient remain still, and that is your lateral view of an elbow. And just for a slight review, so I did take away from the actual projection, some of the criteria or things that should be seen in an AP projection would be the radial head, the neck, tuberosity. There will be slight superimposition of the radius and ulna at the proximal end, and then obviously you'll see the femoral radial joint open. For the lateral, some of the things that you want to see is the elbow joint, obviously, the distal arm, proximal forearm, and most importantly, as I mentioned, the fat pads. If they're there, if there's injury, you'll see them, but that area needs to be shown as well. Okay, and shortly we'll be back for our last projection, which is the Coyle method. All right, guys, for our final projection here is called the Coyle method. This is part 3 of the video. The important thing to get out of this is you do this if there is trauma. There is known trauma to the elbow joint, okay? So we had left off on the lateral of the elbow. Now from this same position, we're gonna go ahead and just put her hand down, okay, which is prone, and we're gonna aim towards the body. Now, whoever got this wrong on the mock, I was one of them. This is why I'm doing this video now, okay? I learned that it's towards the body if you're looking for the radial head side, okay? For that opening, it's gonna be towards the body, guys, okay? And remember, towards the head, radial head, connect those two so you know which way to go. So it's gonna be a 45-degree angle, and you're gonna aim at the elbow joint, okay? All right, so yes. You're going to go ahead and aim at the elbow joint, and you're going to be at about 40 SID, 45-degree angle for your tube, and you're going to aim at the body, okay? This is for your radial joint, the radial side. Okay, the next view is going to be the coronoid. Very simple. Best way is to just slide your tube over your patient. Necessary. You're going to turn your tube 45 degrees the other way. You're going to aim at the elbow joint. So let me just move my tube to 45, guys. I'll be right with you. And then you're going to turn on your light, find the elbow joint again. And this is going to be for the coronoid process. And it's going to be 80 degrees. So you're going to open up just a little bit. For the radial head, it was exactly 90, but for coronoids, 80 degrees. It's going to be a 45 tube angle away from the body. So it's going to be on the other side, like over her shoulder per se. And this is for the coronoid process. Okay, so for the structures or things that we are to be looking for in the Coyle method is for the 90-degree radial head is the radial head capitulum joint. And the other projection for the coronoid, you're going to see the coronoid process and the trochlea open. So those are the ones that you're looking for, and also you will see possibly the fat pads show up if there is trauma to that area. Okay. Last but not least, little things that helped me are going to help me remember this projection is cephalic. As I stated, it usually means like the head, you know. So just remember radial head. Cephalic is where the way to turn towards the body there, towards the head. And then for caudad is for coronoid, CC, caudad, coronoid, radial head, cephalic. So that helps me remember now which way to turn my tube and which way to turn, in what direction I'm trying to go to. So I hope this helps you guys out. And I'll see you at the finals.